Hello, I am Dr. Bipin Theruvil, Senior Consultant in Joint Replacement and Arthroscopy at VPS Lakeshore Hospital. Joint replacements are one of the most successful of all surgeries. We at VPS Lakeshore Hospital take pride in the fact that we run one of the most successful joint replacement programs in the state. We use a number of techniques to make this program successful. We believe that patient education is paramount to improve patient experience through their hospital stay. We educate the patient by providing them pre-operative physiotherapy. So in a nutshell, they are actually prepared even before the surgery for their physiotherapy after the operation. In a total hip replacement, generally we replace two surfaces of the joint, the socket and the ball. So it becomes a total joint replacement. Similarly, if it's a knee, we replace what is called as the thigh bone, which is here, and the tibia or the shin bone. In some cases, we have to resurface the patella, the kneecap as well. These operations take around 1 to 1.5 hours to complete, and generally in the lower limbs, in the hips and the knees, these are done under spinal anesthetic. And if the patient wishes so, they may be put to sleep as well. After the surgery, the patient is moved to an intensive care unit where we start a pain control pathway. We have a specific pain control pathway for the Lakeshore Hospital, which is formulated by the surgeons, anesthetists, and trained nurses. This is a patient-centered pathway, and we ensure that the patient is absolutely pain-free after the surgery. We have a number of techniques, including modifications in surgical technique, whereby we reduce damage to the muscles. We use implants depending on the patient's age and sex, and all these refinements help in mobilizing the patient on the same day after the operation. So the patient is effectively walking without any pain on the same day of operation, and within 2 or 3 days after the surgery, patient can be discharged from the hospital. Following the discharge, the patient will need to use crutches for around 2 to 6 weeks, depending on the general condition of the patient and the mobility of the patient. Normally, hip replacement patients are absolutely pain-free by around 2 weeks, and knee replacement patients take a bit longer. They can take somewhere between 6 weeks to 3 months for the pain to settle completely. A well done hip or a knee replacement generally should last the patient at least 20 to 25 years.